Good morning, this is Ralph Hipp and welcome into HealthWise, the TV show. Have you ever needed quick medical attention right away, probably at an inconvenient time of the day? Well, on our segment right now, we're going to help you think about determining whether an urgent care visit or an emergency room visit is warranted if you have a loved one who's sick or has a sudden accident, particularly after doctor's hours. And we're talking about it with Dr. Miranda Fowler of Cotton O'Neill Express Care. Dr. Fowler, great to have you here.
Thank you for having me.
Welcome to our table.
Thank you, sir.
Well, we know there was the TV show ER. We know what emergency rooms do. Come on in. How would you define express care?
So express care is Cotton O'Neill's version of the urgent care. So an urgent care is an access point to health care that lies on the spectrum between your primary care physician's office and the emergency room. The urgent care is specifically set up to deal with things such as everyday acute illnesses that perhaps your primary care physician can't get you an appointment, or perhaps it's after hours, all the way up to minor emergencies that need attention now but aren't quite severe enough for the emergency room. Cotton O'Neill has 6 express care locations throughout Shawnee County, and these are for everyone in the community, not just Cotton O'Neill physicians' patients.
Now, since you say it's open to all, I would ask what sort of cards, insurance cards, or documentation do we need to get the process started where they will be able to take care of you?
So each express care location is open on most days of the week, all days of the week actually, weekends and most holidays, and they accept all major insurance companies as well as Medicare and Medicaid, and they don't require any appointment at all. You just come in and we get you situated and get you seen.
Miranda, so leaning more toward the emergency room side, if you thought you might have to go there, what are the more serious types of services they can take care of you with at the express care locations?
So it's very important to think about your minor emergency in terms of, is this a threat to a limb or a threat to life? So obviously if you're in a situation where your condition could potentially be life-threatening, that's something that we want you to seek care in the emergency room for. But other types of injuries, broken bones, cuts, lacerations, burns, animal bites, things of that nature are very quite readily cared for in our urgent care setting.
Dr. Fowler, and is it helpful for us to, when we're feeling good and everything is great, to take some time and give some thought to the situation we would be in, urgent care as opposed to the emergency room, and being ready if the need arises? Well,
absolutely. It's important to think about those things before the need arises. If you wake up one morning and you have a fever, or a sore throat, an earache, or you have some sort of minor injury, it's a little bit easier in those cases if you know ahead of time this is something that the urgent care can take care of if my primary care physician isn't available, rather than taking the time to go to the emergency room for those things that could be easily taken care of elsewhere.
As fantastic as express care, urgent care is, when we give some thought to what would we do in this situation, what are the times, Miranda, that we have to go to the emergency room, that urgent care just would not be able to fill what we need at that point?
Well, as I mentioned earlier, anything that is potentially life-threatening is not something that is appropriate.
The limb and life.
So some specifics, chest pain is a big one, particularly in an older adult that has any type of medical background, problems with diabetes or high blood pressure. If you're having any sort of chest pain, that could indicate a serious issue with your heart, and that type of condition is best taken care of in the emergency room. Any types of symptoms that may indicate a stroke, speech difficulties, numbness, weakness, tingling, or memory difficulties, strokes are best taken care of in the emergency room. While the express care is very well equipped to handle broken bones, lacerations, things of that nature. If you have a severe broken bone where the bone is protruding from the skin, or a laceration cut that involves any of the tendons in your hands or your feet, or severe cuts to the face, those are things that are best cared for in the emergency room. But otherwise, small cuts, bruises, broken bones, things of that nature can be taken care of in the urgent care setting.
Are there some other things we should think of, well, urgent care is there, but I think with what we have, we need to wait for the doctor's office to open. our regular primary, the internist or primary care physician, just to wait for that maybe the next day? How do we make that decision without threatening our health?
Absolutely. So if you know that this is a chronic condition for you that hasn't changed, if you're needing a checkup on your blood pressure, if you're needing a refill of a medication that your doctor prescribes for you on a regular basis, those are things that are appropriate for you to wait until the next day. If you aren't sure, Stormont Vail has a Health Connections phone number that is staffed by nursing staff that you can speak with the nurse after hours and overnight until the physician's office opens the next morning. These nurses would be able to take some information from you regarding your health history. In some cases, if you're a Cotton O'Neill physician's patient, they may be able to access your medical record and give you a little bit more information based on the symptoms that you're having, whether or not you need to access care in an urgent care, the emergency room, or if it is okay for you to wait for your physician the next morning.
Dr. Fowler, is this the number we should call to do some telephone work as we're deciding what to do, the 354-5225 at Health Connections?
Yes, that is the Health Connections number, and you can also access our express care locations on the website there. If you do determine that you need to visit an urgent care, our locations are listed on our website.
Great. StormontVail.org. You said there are 6 all through the Topeka-Shawnee County area?
Yes.
Right. And we just have a few seconds. We're with Dr. Miranda Fowler. Urgent care or ER care? And what would you say are the top 2 things that doctors treat at the urgent care facility? Give me a couple.
I would say fever in a child. So we see a lot of
child's fever,
pediatric patients.
Okay.
And simple sprains and broken bones.
To see if it may be a little more compound than
Correct.
that. Well, thank you for sharing this information, and we hope this could be life-saving information too, and I appreciate your time on our show.
Thank you for having me.
Dr. Miranda Fowler, Urgent Care Express Care with Stormont Vail. Well, coming up, and don't sprain your ankle, take care of yourself, and we have our HealthWise TV exercise segment, some fun and invigorating, some fairly low-impact exercises you can do right there in front of the TV set, and be sure to check with your doctor before you start this exercise program or any other to stay healthy.